Hi, I'm Dr. Jen. I'm a fertility doctor, and today I'm going to talk about the fertility consultation, and then we can do live consultations at the end, or live question and answer at the end. So I'm a board certified reproductive endocrinology and fertility doctor, and I wanted to talk about the initial fertility consult. So the first fertility consult will start out with a medical history. So what we're most interested in is your menstrual cycle history. I can tell a lot about your fertility. If you're having any fertility issues, I can tell. I already start forming a diagnosis when I hear about your menstrual cycle history, and the most important things are your cycle regularity, or the interval from one cycle to the next. So I know not everyone's a fan of the tracking apps, and that's okay, but if you have some idea of the number of days from the first day of bleeding in one cycle to the first day of bleeding in your next cycle, so usually that should be about 28 or 30 days. So if it's much shorter than that, that can be a sign of problems with your egg reserve. Sometimes if it's much longer than that 28 to 30 day cycle, that can be a sign of hormone imbalance, sometimes like PCOS. So I can tell a lot about your cycle length. So that's the first thing that I do like to hear about in the initial consultation. And also about your flow, duration of your cycle, how heavy it is. Very heavy bleeding can be a sign of fibroids or other uterine issues like adenomyosis. Also the number of days of bleeding, and how painful your period is. Very painful periods can be a sign of endometriosis or adenomyosis. So those are all really important things for your fertility doctor to know about. It's not, most women don't have to take medications for the pain they have during their period. So if you do need pain medications during your period, that can be a sign of something going on for a lot of women. So that's the menstrual cycle history. That's the first part of the fertility assessment, is going over the menstrual cycle and history and all those pieces of the menstrual cycle. We call it like a vital sign in fertility. It's so important for a fertility doctor to know all about your menstrual cycle. And also, if you're tracking your ovulation, I'd love to know what day you're ovulating, because that will tell me a lot about your hormone balance. So that's another piece that I would like to know about as a fertility doctor. And also would do a deep dive into during a fertility consultation, would do a deep dive into any obstetrical or gynecologic history you have, like any pregnancies or miscarriages, even chemical miscarriages, would want to know about that. And definitely ectopic pregnancies, any fertility treatments or IVF you've done, really would do a deep dive into that and really look into your IVF cycle and want to know about how many eggs you retrieved, how many were fertilized, how many grew into blastocyst, and if you did testing, how many of those tested normal, and really look at all those pieces to see if your IVF cycle did not work, what are things we can do differently or could change for your next cycle. I think that's really important, and I'd love to do a deep dive on any type of fertility treatment you've had in the past. So maybe they've worked or not worked, but it's really good to know about them. And then also I like to review any surgeries you may have had, especially GYN surgeries like hysteroscopies or myomectomies, which is a removal of the fibroids. So those are really important to review, or if you've had your fallopian tubes removed or tied for any reason, that would be really important for me to know about. Any history of ovarian cysts or surgery on your ovaries for ovarian cysts, because it's a very common cause of lower egg reserve that I see in patients. So those will all be really important things to go over. And then medications, so whether they're fertility medications or not, all medications are important to know about. We want to look how they would affect a pregnancy, since hopefully, when seeing a fertility doctor, you'll be pregnant soon. So we want to look at how they would if they would be safe in pregnancy, and any other medications you can take, even medications like thyroid medication, which can affect ovulation. That's important to know about as well. And then as well as any supplements or over-the-counter medications, I would say almost all of my patients are taking a supplement for egg quality, so you can let me know what your favorite one is. I do like CoQ10 for my patients for egg quality, but I would definitely want to know about all the supplements and vitamins that you're taking as well. And then I don't want to forget to mention the male partner. If you have a male partner, sometimes you're going to be a single mom by choice or a same-sex couple, but if you have a male partner, then I would want to know about their history. So any medical conditions or surgeries they've had, any medications they're taking. Because listen, the male factor plays a role in about 40 to 50% of couples who are having trouble getting pregnant. So it's really important to look at the history for your male partner if you have one, and to know about their fertility history, if they've had children in the past, or if they've ever had a semen analysis. If not, that is definitely one of the first things I would like to check. So that all goes into that initial fertility consultation as well. So that's all gathering history, your cycle history, your medical history, any pregnancy history, and your partner's history. So I'm Dr. Jen, for those just joining, a board-certified fertility doctor, and I'm talking about the initial fertility consultation and assessment. And we went over medical history. And the next step is basically fertility assessment and testing. So the basics of fertility testing are, you want a basic hormone panel. So pretty much anytime you go into a fertility doctor, you will get a basic hormone panel. And I do have patients ask me a lot, well, I just had one a year ago. Do I need to repeat it? Fertility doctors really like to see your hormones frequently, because your hormones cycle, so they're going to change. A year ago, they're going to be very different for most women than they are that day. And that day, your hormones will go up and down through your cycle. So it's really helpful to get a sort of snapshot into your ovulation and your menstrual cycle to look at your hormones and pair that with an ultrasound, because then we really get a really nice fertility snapshot. So I know based on your cycle day, so that's a piece of the history I didn't mention, but we always want to know your cycle day. So what day are you in your cycle? The first day being cycle day 1. Because once I know what cycle day you're on, I'll already have an idea in my head what your hormones should be for that cycle day, what your ovaries should look like for that cycle day. And so then if I can check your hormone panel and check your ultrasound that same day, I can put all those pieces together, and it helps me understand about your ovulation, about any hormone imbalance, because it's really all those 3 pieces together. So on that specific cycle day, what are your hormones and what is your ultrasound showing? That's really powerful information for a fertility doctor. So, you will hear a lot of fertility doctors say, well, you had a hormone panel last week, but we want to know on this particular cycle day, what are all those 3 things looking like? It's really powerful information. So the fertility panel is looking at your estrogen, because growing eggs make estrogen, and that goes up and down through your cycle. You want to look at hormones FSH and LH. Those are made by the brain and tell your ovaries to grow eggs, and once the egg is growing, your estrogen will rise. And then progesterone, so that's made only after ovulation. So we look at your progesterone level. Usually we'll always check a beta HCG level, just because you never know, and we like to have that as a baseline check. And a lot of times we would add on an AMH. That's a hormone that can be checked any day of your cycle to look at your egg reserve, and it's really helpful in dosing fertility medications as well. So I'm Dr. Jen. I'm a fertility doctor talking about the initial fertility consultation and fertility assessment and testing. So that's the hormone panel. Oftentimes we'll also check a baseline thyroid hormone level and prolactin level, because if there's elevations in your TSH or prolactin, that can cause your ovulation to be off. And we always like to have a baseline check on those 2 levels. So that's just a very most common panel you're going to get when you go in to see a fertility doctor of those basic hormones. And as well, if you are going to be going right into treatment, oftentimes you'll have an infectious disease screening too. That's needed, especially if you're doing IVF, to work with eggs and sperm. So for both the female and male partner, if you have one, we need a basic infectious disease screening. And also a genetic screening is recommended before you get pregnant, so that you can see if you're a carrier for common genetic disorders before you get pregnant. Otherwise, once you're pregnant, you would go to your OBGYN and they would run it, but you're already pregnant. So it is better to know, it's not required, but it is better to know before you get pregnant if you and your partner are sort of a mismatch for a genetic disorder. That can also be addressed through IVF as well. It's not very common, honestly. It's pretty unusual for you and your partner to have the same genetic disorder, but it is something that we check for before starting fertility treatment or before you would get pregnant. So those are the basic, that's blood work that may be ordered before treatment, but the basic assessment, again, is that hormone panel to really look at your ovulation and your egg supply. And again, that's always paired with an ultrasound. That really gives us the best information. This is usually a transvaginal ultrasound because you can see your uterus and your ovaries most clearly with a transvaginal ultrasound. So with a transvaginal ultrasound, the first thing we'd look at is your uterus. So you want to look at the shape and size of your uterus and how your uterus looks on ultrasound. There's sometimes like enlarged uterus that has certain shadowing on the ultrasound can be a sign of like adenomyosis. Uterine fibroids are very common. I see them all day, every day in women. And so we're always checking for that when we do the ultrasound of your uterus. And sometimes they're small and towards the outside of your uterus, that's not going to be as big a problem for fertility. But we always want to see where they are and measure them. So these are things to check, we check on the uterus. And another reason to know your cycle day is because then we can look at your lining or your endometrial lining of your uterus. That's gonna vary because you grow and shed it every month. That's how you get your period. And so if we know the cycle day, then we can look at your lining and the appearance of your lining and make sure it's appropriate and the thickness is appropriate for your cycle day. So those are all things to look for on the ultrasound and then of the uterus. And then we also look at your ovaries. So on your ovaries, we want to look at your right and your left ovary. And on your ovary, we look for cysts. Most women that have small cysts don't even know that they have them. There's not necessarily a lot of symptoms always from ovarian cysts, so we always check the ovaries for a cyst on your ovary. And then what we're really interested in is looking at those little eggs on your ovary, because every day of your cycle, it doesn't matter on what cycle day you are, you will have a little group of eggs on your ovary. And we want to check those eggs and actually go through and count the little eggs that we see in your ovary. It's not all your eggs, but it's the group that you have that month. And that tells us about your overall egg supply. So we'll go through each ovary and count all those little eggs and give you an antral follicle count. And that tells us a lot about your egg reserve. So, and then depending on your cycle day, sometimes we see that dominant follicle that's getting ready to ovulate. So that can be reassuring if you're mid-cycle that we're seeing that. After ovulation, we can see what's called a corpus luteum. It's the structure on the ovary that makes lots of progesterone. So we can see that on ultrasound too. So there's so many things we can see about your ultrasound, and doing it in real time is really helpful. I will say I do have some patients who come with an ultrasound, but it wasn't done by a fertility doctor. And often those reports are pretty basic when it comes to fertility, and we're missing a lot of that detail that fertility doctors really like the egg count, the pattern of the uterus, the exact cycle day the ultrasound was done on. So these are reasons why the initial fertility consult will usually include an ultrasound. It just gives so much great information about your fertility. So those are the basics of when you first go in to see a fertility doctor. So the history, focusing on the menstrual cycle history and your obstetrical or GYN history. If you have a male partner, their history as well, because they play a big role in your fertility as a couple. And then the initial testing you may get that first day. Most blood work is drawn and run in the fertility office, so fertility doctor will get it back the exact same day, which is really nice because you get that snapshot of your fertility on your cycle day, and you get all that information back the same day. So that's that hormone panel to include estrogen, FSH, LH, progesterone, beta-HCG, TSH, prolactin, and AMH. So those are all the basic fertility hormones. And then that ultrasound, that is super helpful. Now, follow-up testing could include infectious disease screening, genetic screening for you and your partner, and the semen analysis is really important if that's not done. And the other piece of follow-up testing that may be done is what's called the HSG. This depends on if you're doing IVF or IUI, but HSG, because that can check on your fallopian tubes, which are not usually well seen on ultrasound. So that's a follow-up test that may be done later